people joining, and we're just waiting for some of our guest speakers as well. So if you want to grab yourself just a quick cup of tea, we'll start shortly. Hi, Catherine.
Hi, how you doing?
I'm good. I'm good. How are you doing?
Yeah, good, thank you.
Good. We're just going to leave it a few minutes just so there might be a couple of people that are just late joining. So just said if they just want to grab themselves a quick cup of tea, then please do so. But we'll start in a couple of minutes if that's okay with everyone.
Yeah, no worries.
Thank you.
For a glass of wine.
Yeah.
How many are you expecting this evening, Rashri?
Well, they don't register, remember, so we don't. Yeah, so so this is an open house surgery. It's a drop-in session, so people will just come in as and when. So we don't. It's not a registration event. So I'll just give it one more minute and then we'll make a start because I feel that there's a few more people wanting to join. So I'm hoping you can all see my screen for now, just with the community pharmacy. If you can give me the thumbs up, somebody. You can see my slide. Yeah. Okay. Well, it's 4 minutes past 8, so I think it's fair to make a start considering we've only got an hour. We've factored in till 9 p.m. and I don't think a large majority of us want to stay here beyond 9. So first of all, warm welcome to you all. Thank you for joining and taking the time out of your evening to join us today for our drop-in open house surgery for this month, for April. Kate, can you just ensure that you're recording it for me? Is it recording?
Yeah, it's already started recording.
Oh, fabulous. Thank you. So a bit of housekeeping just before I begin, and I'll introduce myself, of course. My name's Rajshri Owen. I'm the Chief Officer for Community Pharmacy Leicester and Rutland. I think I know a lot of you already that have joined the call, but if you don't, it's just nice to put a face to the name as well. And you'll have my contact details a bit further on in the slides as well. With respect for the speakers, if you're not speaking, if you can just pop yourselves on mute, that would be really grateful, just so that we can have a seamless webinar today and ensure that everyone can hear the speaker as well. There is the opportunity to ask questions throughout at the end of each of the speakers at the end of the presentation, but please do feel free to use the chat as well. The chat will be monitored by myself and my colleagues from the Community Pharmacy Leicester and Rutland team as well. So please do use the chat function and also raise your hand at the end of the presentation, and be happy to answer those questions for you. So with that said, I'm going to make a start just to get things going. So we do have, just make sure. There we go. So before I go into the agenda, kind of a standing item agenda, but we always talk about our social media platforms. And when I speak to a lot of contractors, they're not aware that we have been set up on social media. So we're on Facebook, Instagram, LinkedIn. We also have our WhatsApp group. So with regards to, excuse me, the social media platforms, if you can join us, like us, share us, get involved. There's a lot of information, appreciate, that come through from me and the team via email, but there's also different information that comes through via our social media posts as well, including some regional information and resources as well. So if you're not, please do feel free to join us, like us, share us on those 3 platforms. And also, if you're not part of the WhatsApp group, which has been set up for contractors within Community Pharmacy Leicester and Rutland, please do get in touch. You can either email myself or you can drop me a quick WhatsApp or message on that mobile below, highlighted in the red. And of course, if you're not getting my emails, which I hope you all should, but if you're not, then please do drop me an email at the email address below as well, chiefofficer@lest-lpc.co.uk. Thank you. So in terms of the agenda today, like I said, we've got an hour with you. And I'm going to give you a brief update from Community Pharmacy Leicester and Rutland. We do have Paul here as well, who's the Community Pharmacy Clinical Lead from the ICB. So I'll hand over to Paul if there's anything that he needs to update anyone on, any of our contractors, that is. But it's rather a quick update, to be fair. I'm really pleased, and that's partly because I'm really pleased that we've got some guest speakers with us tonight. We're joined by a couple of colleagues from AccuRx, including Catherine Webb, who's the operations manager, to talk about AccuRx platform and how it can serve you as community pharmacists in LLR. And then we're going to have a quick update from Gareth, and Gareth is our service delivery facilitator, updating us in terms of his visits, his contractor visits that he's been conducting over the last month or so. With regards to Pharmacy First, and just in terms of his findings of what issues are affecting you as contractors in relation to Pharmacy First. So with that said, in terms of updates, I'm hoping you can all see this. Let me just move my screen. I couldn't go any further without talking about MFA. I know it's affected a number of you. I've spoken to a lot of you when it first appeared to be an issue back in mid-March. And to be fair, I think I spent the entire 2 days speaking to a lot of contractors, trying to get through that. There are clearly still some issues that are affecting you, and we're working our way through that as well. So we've added a help page on our website, and the link is there and I'll put the link in the chat throughout the presentation today. But there's an issue, there is a help page for you to access, which goes through some FAQs of what to do, who to contact. And really, what should you do if you have submitted, which is one of the most common questions, if you've submitted your claim with incorrect information, well, you need to contact immediately the MYS team at BSA for further guidance on how you can review that claim as well. If you're unsure, if your query or concern isn't answered in our help page, or you just don't know where to turn to, feel free to contact myself directly at the same email address that I shared with you in the previous slide, and we'll try and signpost you in the right manner as well. So appreciate it's still affecting a number of you. Okay, with regards to what we have done from a Community Pharmacy Leicester and Rutland perspective, I know it's been incredibly difficult, it's been challenging for you, but we've made it really clear and fed this back to Community Pharmacy England that actually it's been that it's unacceptable effect this has had on pharmacies, including on your workload and stress, and we're extremely concerned about the impact on providers and patients, and that's verbatim in terms of feedback that I've fed back personally to Community Pharmacy England. The response from Community Pharmacy England is there that I've received. So they're pressing government and obviously the NHS for urgent action to resolve the problems. And more importantly, restore faith in the data and payment mechanism so that pharmacies are fairly recompensed for their hard work in delivering a vital new service. So I just wanted to reassure contractors who have joined us today on this call that your concerns, your concerns, issues have been fed back verbatim back to Community Pharmacy England on behalf of all contractors within LLR, and that's the response that we're receiving from CPE. But we are aware that, like I said in the previous slide, there are still some queries, some niggles that's still happening. And if you are one of those contractors, then feel free to contact me, and we'll try and support you in the best way that we can, and also, of course, feed that back as well. Yeah, so in terms of Pharmacy First, and I know Gareth is going to talk about Pharmacy First, but I just wanted to highlight that Gareth continues to be able to support contractors on a Friday to conduct contractor visits, specifically pertaining to Pharmacy First, and that includes supporting you around surgery visits, but also looking at the issues that you are experiencing with regards to Pharmacy First. So I won't take the light off Gareth, but I just thought it'd be important just to highlight some of the issues or some of the available resources, to support practice and pharmacy teams out there as well. So if you look on the third point, highlighted in blue, and this is a hyperlink. So again, I'll pop that in the chat. But we have produced a number of local resources to LLR to support surgery practice teams with regards to making referrals into community pharmacy. Also, if you're aware that last week, Community Pharmacy England also launched some national resources, and these resources sit on their Pharmacy First information for GPs webpage. There's a lot of resources in there, including some infographics and also a video as well. In terms of the LLR resources, I'm not going to walk you through any of these because we've done that in previous open house surgeries, where Gareth very eloquently and has spent a lot of time going through each of these slides. But I just wanted to flash these up to make you aware that they are still available on the website for you to enable you to support your discussions, conversations with practices and other stakeholders within the Pharmacy First architecture. And this is more of the national resources that I've alluded to that Community Pharmacy England launched last week. And I'm still getting a few queries around what can we do with, how can we inform GPs about Pharmacy First? What resources have you got, Rajshri? And so all those links that I've alluded to in my previous slide are exactly that. It really covers what GPs need to know. And this is taken from, this screenshot is taken from Community Pharmacy England's new infographic. So it explains very eloquently again what GPs need to know, a top line, of course, and there's a wealth of resources. Again, I've put them in the link, but also if you scan that QR code, it should take you to the precise web page on the CPE website as well. So I'm just going to see if this works. It's a quick video which I wanted to share with you with regards to what Community Pharmacy England have done. It's a 2-minute video, and I'm hoping that this will work. So please do let me know if it doesn't, because I can't see anybody's faces, so you will have to unmute yourself to let me know. But let's play it, and hopefully it will answer a number of your questions with regards to GP resources available.
It's not playing.
It's not
Rajshri.
coming up for me.
Oh, okay. I'm sorry, guys. Then I thought it might do, but it's not. Okay, hang on. Let me just, thank you. Let me just see what I've done. But you probably could hear it. Could you hear it?
No.
Oh, okay. That doesn't help.
Let me see if I can get it up.
Thanks, Kate. I'll stop sharing for now.
Sorry, I was just copying your link. New pharmacist first. Okay, hang on, let me share my screen.
Thanks, Kate.
Is that working?
We just can't hear it, Kate.
I don't know how to get it to share the sound with
That's
you.
okay. That's okay, no problem. So, guys, we'll skip the video, just conscious of time, but it's a 2-minute video that's available in the public domain on Community Pharmacy England website. You can see from Kate's sharing screen, it's very easy to access. But that is designed to enable you to have conversations with GP practice and describe exactly what, oh, thanks, Kate, you popped it in the chat, to explain what Pharmacy First is about. And it also helps in terms of on a PCN level as well. So maybe not just GP practice, but also practice team staff, as well as clinical directors as well, or even if you've been invited to a PCN or a clinical pharmacist meeting as well. Okay, so with that said, I think that I'm just going to go through my presentation. That's the end of my update. And if you have any questions, and I'm just going to see if there are any hands up from myself, please feel free to ask. But I can't see any comments or any hands up. I'm going to hand over and introduce my, oh, sorry, Nadeem, come on in before I introduce colleagues. Nadeem? Do you want to mute yourself because I can't hear you? Nadeem, we can't hear you. Nadeem, if there is a question, do you want to just add it into the chat and I'll pick it up in a moment? So I'm gonna move on and just introduce our colleagues who have joined us very kindly tonight from AccuRx. Catherine, do you want to just introduce yourself and then the team that you've got here tonight for everybody? But if I hand over to you, and you will be able to share the screen if you've got any slides. Thank you.
Great, thank you. Hi, I'm Catherine. Thanks so much for having us. I'm an operations manager at AccuRx, working with community pharmacy at the moment. So yeah, speaking to lots of pharmacies, doing visits, helping them get set up, all of that type of thing. And then I'm here with my colleague, Hannah.
Hi everyone, I'm Hannah. I'm a market director for pharmacy and GP, so also helping Catherine get us set up in pharmacy. Nice to meet you all.
Can you see my screen?
Yes, we can see that. That's brilliant.
Is that working? So a brief overview of AccuRx. AccuRx is the simple way to communicate about patient care. You might have heard of AccuRx already. Either maybe you've worked in a GP practice and you've seen it there, or you've heard from colleagues that work in primary care who use it. Over 98% of GP practices in England currently use us. So lots of people using it there. And in pharmacy, we've recently launched. So I thought I'd give you a bit of an overview of what you can do in AccuRx for pharmacies. So there's a little bit that I shared ahead of time that will be shared on your website afterwards. And you can use that link to log in, but it's web.accurx.com. But yeah, we can share that afterwards. So if you navigate there, you'll then be able to log in with your NHS mail. So you don't need an additional sign in, you don't need a different account, you just to sign in, and then it'll ask you to choose your pharmacy. So you can either put in the ODS code or you can put in the name of your pharmacy, and then you'll be able to join your own pharmacy organisation. This is the demo environment, so I'm just going to log straight in. But if you set up your own organisation, you're then able to, via the organisation settings, like manage the different users at your pharmacy. And you need some of these like approvals in order to view certain features such as patient responses. So this is the page that you land on when you sign into AccuRx. Everything starts by searching for a patient. You need their NHS number and date of birth. So if you type in their NHS number and date of birth, and click search. You can also do this with a test patient and then type in your own mobile phone number, and then you're able to see what it looks like from the patient side as well. But I'm going to use Julie Adams here. So if you search for a patient, their patient profile comes up. So the first thing I'm going to show you is messaging a patient. So if you click message patient, this screen comes up. So you're able to send a message to a patient via SMS. Patients will be really used to getting messages like this via Accurex from their GP practice. The patients don't need to download an app. They don't need a login. This will just be an SMS sent straight to their phone. So here you can send them any message you want. It could be your prescription's ready to collect, or it could be a question, or it could be asking them to give you some information. So you can attach a file here. So if you wanted to send the patient something, you can attach that. You can also send them a link. So if you wanted to send them a link to some NHS guidelines, giving them more information or telling them what to do, maybe if their condition gets worse, you can type that in here. You can have your own templates. So we've got some templates set up for you already, but a lot of people like to create their own templates. So you might want one for your prescription's ready to collect, and you might want one for after you've spoken to someone about tonsillitis with some more information about tonsillitis. We know that for Pharmacy First, quite a lot of people have been using this for safety netting advice to give patients guidelines about what to do if it gets worse, and information about conditions after you've spoken to them. So we know some people have a template for each of the Pharmacy First conditions, for example. The other thing that we're launching soon is questionnaires. So you won't be able to see this when you log in at the moment, but it's something that we're going to be launching very soon. So there are some lifestyle and demographic questionnaires, and then there are some more specific to pharmacy questionnaires. So some eligibility questions for flu and COVID, and then some for the Pharmacy First conditions, as well as a new medicine service one. So if I just quickly show you the flu vaccinations one, for example, you can see what this would look like for a patient. It comes up with questions. This is the demo environment, so not all the questions are proper, but patients are able to type in like free text responses, and also yes or no, or add a picture. There's various different question types, and then the patient can submit it. In order for the patients to fill this in, they need to enter their date of birth, but they don't need to download an app or anything. When those responses come back from patients, they come into these folders here. This is also a little bit different to what yours will look like, because this is a new inbox which is rolling out currently at the moment. So this is what yours will look like either now or soon. And then the questionnaires all come back into different folders based on what the questionnaire was. So for example, I'll show you the sore throat one. This is what it looks like when the patient completes it. So you can see the questions, you can see their answers, and then you can download that if you want, and you can reply to the patient from here if you wanted to ask them further questions, or if you wanted to say, please come to the pharmacy for consultation, or you need to letting the patient know that you perhaps need to refer them back to the GP. So if I go back to the patient search, I'm just going to use a test patient now. One of the other things you can do is video consultation. So if you select video consultation, you can, this is because it's a test patient, you can enter your own mobile phone number if you wanted to check this out, but otherwise it will pull up the mobile phone number for the patient. I should have said that before about the other messages. It pulls the patient's mobile number from the spine, from the directory, so you won't need to enter the patient's mobile phone number. For the video consultation, it sends a link to a patient with that they can click on, and it starts a video consultation, and they can do that on a mobile phone, on a laptop. They don't need to download an app or log in. When the link generates, you're also able to share that with other people if you needed to. So if you needed to include other members, perhaps of the patient's family, or a translator, you can share that link, and multiple people are able to join that video call. What we've found from speaking to some users is it's really helpful if you maybe text a patient beforehand to let them know that you are going to be doing sending them a link for a video consultation, and then they're more likely to join that call at the right time. So we've heard of some people that have templates that say, I'm going to invite you to a video call in about an hour. So the patient has a bit of warning, and they're therefore more likely to join the video consultation. You can also have your own video specific template. So you could create templates that are, here's a video link for an hour's time, or whatever would be appropriate for you. If I go back to patients here, then one of the other things you can do if you search for a patient is request their GP record. If you do this, it then will send the patient a code. You then need that code in order to view their record. So you're seeking consent from the patient here. And if you get that from the patient and type it in, you'll be able to see their medical record. And we get this through our integration with the medical system, the record systems within primary care. So this is got a bit more information in it than the summary care record. And it has like active and past problems, as well as medications and allergies, investigations, which includes like blood tests that they may have had, as well as immunizations, which might be suitable for like travel vaccines if you want to see what other vaccinations they've had. So that's a bit of a quick overview of all the features there. The other thing that is quite useful is patient lists. So if you just search for a patient, you need to type in their NHS number of date of birth, which only takes a few seconds, but you can also add your patients to a patient list. So for example, you could have patients that are on your new medicine service or IP Pathfinder, or you've seen about a certain condition, or perhaps your long-term condition patients or your hypertension patients, and you can create a new list, and you can upload patients via a CSV. So if you're able to download a list from your PMR, you can just upload a CSV of their NHS number and date of birth, and then it'll create a list here. And then within that list, you can just search there. You don't need to type in the NHS number and date of birth again. So that can just save you a bit of time and also help with the patient management side of things. This is what the inbox looks like. So if you message patients, let me just go back and show you here. So back in message patients, you can allow the patient to reply. This is off by default. So if you just send a message to a patient, they won't be able to reply. But if you tick this box, they're able to reply either with text or with a photo. So this can be quite useful for saying things like, we're currently out of stock of your medication, but we're due to get some more in next week. Do you have enough to last you until then? And then the patient can reply, saving you a phone call. You could also ask the patient to take a photo of a rash. You could also ask the patient to take a photo of maybe a discharge letter from hospital, which can be quite useful. And then those responses will come into your inbox. So you'll be able to see messages from patients here. For example, this is one I sent earlier, we're out of stock of this medication, and then the patient can reply. This is where it's important to have those like approvals set up for your colleagues, and that will mean that multiple people will be able to see the patient responses. So perhaps if one person sends a questionnaire one day or messages a patient, but then is off the next day, someone else will be able to see those responses. That's a quick overview of all the features. There's quite a lot in there. Does anyone have any questions?
Thanks, Catherine. We'll just see if there's any hands up. Just to reiterate, the platform's free to access, and the features that you've described are free to community pharmacy. Just want to make that really clear to our pharmacists that joined us tonight. Yeah,
sorry. So you sign in with your personal NHS account. We ask you to do that rather than using like a generic pharmacy account, and that is for that like audit reason, being able to know who's messaged the patients. And yeah, it's completely free. Everything I've shown you is free. You're able to send 300 messages a day to patients. there might be things that we're piloting in the future that might incur additional costs, but everything that I've shown at the moment is free.
Brilliant. So I'll just try and bat all the questions because we've had a few hands up whilst you were talking there. So Adil, do you want to come in first?
Mine is just a very quick question. Can users have multiple sites registered on their account? So, for example, with me, I work across maybe 3-4 sites. So, would I be able to have them on one NHS mail, or would it request multiple accounts?
Yeah, so when you go through the sign up flow and you're asked to choose a pharmacy, you can join multiple. I can share the particular link with you that enables you to join multiple, because we know that is quite common that people work across multiple sites. And then you can just be set up at different ones. And then let me quickly share again, sorry. Can you see that now? If you go to organisation here, you can toggle between the different organisations that you're part of.
Right, okay, no, that's cool. That's absolutely fine. No, that's great. And one more question that I had as well is there, as you said, there's no charge. Would this allow are all surgeries registered to use this as well? So, for example, I know, like, for example, with things like pharma outcomes, not all surgeries are registered to provide the digital part of their service. But with AccuRx, would I be able to access any patient information that I need relevant to Pharmacy First, for example? Would all GPs be registered, or is there some practices that haven't registered with this to provide information?
Yeah, it actually doesn't need the GP practices to be registered. We look that patient up on the spine. So it doesn't, perhaps if you're like a distance selling pharmacy, you'll also be able to look up patients aren't necessarily in your local area.
That's absolutely fine. Brilliant. Thank you very much.
No
Thanks,
worries.
Adil. Thank you. Paul, do you want to come in?
Yeah, thanks. I'd just like to highlight the potential as well, the messaging GP practices as well. If you are struggling to work out ways of communicating effectively with GP practices, AccuRx might be an option because you can do inbox messaging, and I think all GP practices, bar one or virtually all anyway in LLR, do have AccuRx. I think that needs to be agreed locally. I don't think you should start messaging GP practices through AccuRx just randomly. I think, but it could be a solution for if you are struggling to get hold of GP practices or to have a robust communication method. It might be an option to discuss locally with your neighbouring practices.
Just to say on that, the even though most GP practices in Leicester are using AccuRx, they don't necessarily have the feature to receive inbound messages from pharmacies switched on. That's definitely a conversation we're more than happy to pick up with the ICB and some of the practices in the area. Yeah, exactly like you said, Paul, it's worth talking to the GP practices about that, because if GP practices would like to receive messages through AccuRx, we can turn that on for them. And we've seen that work really well in some other ICBs where we've got GP practices and pharmacies to work together and decide how they want to receive communication. But yeah, just to say in this area at the moment, that inbound functionality to receive messages from pharmacies is quite low. So it probably you wouldn't be able to see that option.
Thanks, Catherine, and thanks, Paul, for that. We've got one more question from Iqbal. Iqbal, do you want to come in?
Hi, I just want to know that does the patient need to install any app, or they have to reply through the link? Because most of our patients, they won't know how to reply through the link and everything.
Yeah, so they don't need any app or anything or any sign up, because we know that there are some other patient apps, but it can be difficult if not all the patients have it downloaded. So the messages that you send will go via an SMS, so they don't even need a smartphone, it just comes via SMS. If you send them a questionnaire, they click on the link and they'll need to type in their date of birth, but that's all that they'll need to enter. So yeah, hopefully that doesn't seem to be an issue for most patients. Like I said, a lot of patients will be used to receiving communication like this and questionnaires like this from their GP practices. So in general, we see pretty good uptake from patients.
Okay, thank you.
Thanks, Iqbal. I can't see any more hands up. Any last minute or anything to summarise, Catherine or Hannah, to add before we hand over to Paul? Because I can't see any more hands up or questions coming through.
Just to say, more than happy to provide any additional support. My email address is Catherine@Accurex if you have any questions. And yeah, I think you're going to share something on your page to get started. Yeah, and then if anyone has any questions or any help, our user support team is also really great and work quite long hours into the evenings and I think Saturday mornings. So within the product, in the bottom left hand corner, it says chat with us, and if you use that, you can talk to the support team, and they're really great at solving problems very quickly, usually in a few minutes.
That's brilliant, Catherine and Hannah. Thank you so much for coming in to join us today just to talk about AccuRx, and I've learned a lot about the platform as well. And I hope some of our contractors have that joined us tonight as well, and maybe you'll get a few more sign-ups as a result within LLR, both from community pharmacy and practices as a result of this. But thank you ever so much, and I will add the details onto our website from Hannah's presentation, but also there's some additional information that will go on shortly onto our website about AccuRx, including Catherine's email address as well, if anybody needs to get in touch with her or AccuRx directly as well. Thank you both.
Thank you.
Bye.
Thanks so much.
Thank you. Bye-bye.
Bye.
Great. So before I move on to Gareth, Paul, I realised I skipped past you, so I am sorry. And that was not intentionally at all. But I just wonder, is there anything that you would like to say to contractors, any in terms of updates or key messages?
Just a couple of minutes, yeah. Just got a couple
Yeah,
of things
course.
to update verbally, if that's possible. So thank you very much for having me tonight. Glad Rajshri spoke about multi-factor authentication. It's certainly been very challenging, both from the ICB and practice side as well. And we are aware that we think it's caused a dip in pharmacy first referrals, certainly via Pharma Refer. And if you're aware of any practices that were using Pharma Refer, or you're getting integrated referrals direct into Pharma Outcomes prior to MFA, and have since that's really dropped off particular practices, you can let us know at the ICB so we can follow up those practices to understand what they're struggling with, and support them putting that in place themselves. It certainly caught us a little bit unawares, and certainly we've having a lot of work behind the scenes to try to ensure practices can continue. I flagged it today at a regional meeting as probably the single biggest risk for pharmacy first delivery at the moment. But certainly we're looking at, we can support practices if needed, if you're aware that they're struggling. So please link them to myself and Mel to do that. Just regarding the stop smoking service, if you have previously registered for the stop smoking service and you can't no longer offer it due to staff changes, then please deregister from the service, because we are getting referrals through from UHL a couple of weeks now, and it is a little bit heartbreaking to have to tell them, unfortunately, the pharmacy they've referred to can no longer offer the service. So if you can let us know, you can deregister without penalty and then re-register when you are in a position to offer it. Also hoping that LPT will go live for referrals in the next couple of months. I appreciate I've been saying that for about 6 months now, but they are slowly moving forward. I believe we have got a follow-up meeting next week. This regards a broader update on IP pathway. I'm sure a couple of IP contractors are here tonight and obviously had separate updates from me, but as a broader global update, we are just waiting for the final sign off for the IT solution, for the e-prescribing solution, and then hopefully we will that service can start to commence for the 4 sites in LLR, and then obviously inform future models of delivery as increasingly the community pharmacy workforce is IP qualified. So hopefully we will start to see some sites maybe by the end of May, hopefully, fingers crossed, being able to take that one forward. There will be opportunities for pharmacy to pharmacy referrals within that, but when we're live and we can explain a little bit more, I'll probably come back, especially if I can come back to update you all. So regarding the discharge medicine service, which is a really incredibly important service for patients and has a real impact across the system in reducing readmissions. So if you do get referrals coming through, please can you accept them, and please can you process them. There's a huge amount of unearned income available from DMS referrals that are sent and not picked up. I expect most of the people on here are very good, looking at the names, but obviously ensure that there are processes with, when you're not there, if it's locum run, DMS can still be picked up. Great opportunity there. But if you're struggling, get in touch with obviously LPC service support colleagues or myself to support you if you're unsure what needs to be done. But yeah, loads of opportunity there, both from a patient, clinical, and a financial perspective. And just finally, just around Pharmacy First, I've touched on the MFA issues, but yeah, I think we've learned through CPCS and we're learning Pharmacy First that it's really important that ongoing engagement between pharmacies and practices locally is really essential for making it work. Where that happens, people talk to each other regularly, you don't fall out, and any little issues can be resolved really soon without sort of flaring up and impacting on the number of referrals and obviously the patient care and pharmacy income. So, do regularly reach out to your practice around it, even if you think it's working really, really well. There's a couple of pharmacies I'm aware of have seen a little bit of a tail off in the past couple of months on referrals. MFA is probably part of that, but part of it's perhaps it's just dropped off there. Horizon priorities, there's a big turnover of frontline GP reception staff. It's a really challenging role, in my opinion, one of the most challenging in the NHS. So they do have a quite significant churn. So I think it's really important if you can just keep engaging loads of resources, as Gareth has previously talked about Rajshri today, around engaging with GP practices around it. We'll continue at the ICB to do our bit and pushing it at scale, and obviously, supporting practices who report they're struggling or flag up, or even we get a little sniff that they're struggling, we'll get in touch with them. But nothing beats local pharmacies speaking to practices around it, really doesn't. So please keep going. And finally, around pharmacies, if you are aware of practices who are signposting a lot and not referring very much, then again, if you can let ourselves know, myself directly or via the LPC, we're happy to try and follow up with practices. I can't make practices, refer if they really, really don't want to, but I think we can try and encourage them and move them over time to do that. So do flag those practices up to myself, Mel, directly, or via Rajshri and her colleagues at the LPC. Hopefully, most of you have got my contact email addresses. Do feel free to drop me a line if anything you're struggling with, and I'll see what I can help. Most things we can resolve eventually. A lot of DOS queries. We've solved everyone so far, apart from the one there's a recent issue under this distance selling pharmacy we've not yet resolved. We do, so if any issues, if we don't know about them, we can't solve them. If you let us know, please come to us and see what we can do.
Brilliant. Thank you, Paul. Thank you. That's great. So I've just popped your email address in the chat. So if anyone hasn't got it, then it's there for you to pick up. But thank you for that update. That's been really helpful. So I'm just conscious of time, and we've still got one presenter left. So I'm just going to share my screen and I'm going to hand over to Gareth. So Gareth, do you want to, I'll just try and get your presentation up. Bear with me. Okay. So let me know if you can all see that. Somebody let me know. Yes, I presume you can.
Hello, can everyone
Yeah.
hear me?
Okay, Gareth.
Okay, that's wonderful. So this is going to be a quick one. Some of the thunder has already been stolen, so I'll skip a few slides as we skip through this. So it's been a frenetic time since January, with lots going on, and the objective here is to just pause for a moment to reflect on what has been learned, so that the problems we have seen don't have to be experienced by everybody. So the broader issues arising that I've come across as I've been supporting pharmacies over Fridays this last couple of months, there's the study requirements, getting service ready. You need to get your locum service ready, and people are saying they're feeling overwhelmed by it all. And you've still got contraception services and things like that might be still on the back burner. The operational time pressures, how are you squeezing it all in with your dispensing, etc. Surgery referrals are problematic, and pharmacists are pulling their hair out. Paul has alluded to that. Commercial reporting, we're going to touch on that. Service volumes, your claims, your service thresholds for your incentives, multi-factor authentication. We'll skip through that when we get there. Rashri, we'll keep going. Rashri, the next slide there, please. Okay, so thank you for that. So the traditional approach to getting ready for services, whether it's pharmacy first or contraception service or whatever it is, but if you go back in time before all of the pharm outcomes support was with us, pharmacists, when there was a new service presenting, you would get stuck into your CPPE material. It's the first thing you would do. If there were PGDs, you would get into those as well. You would hopefully study the service level agreement, and at some point you would get your head into the service delivery forms. Do you remember the service delivery forms with extended care and all of that stuff? And then you would start cracking on and with your first patient. But if you next slide there, Ashley, please. But what we're seeing is the volume of reading is absolutely overwhelming. The traditional approach of and going 1, 2, 3, as I've just outlined, it's absolutely overwhelming. And now you see CPPA and also in the PGDs, they've embedded dozens of underlined blue URLs to click on. And if you click on those, you're going to go down a clinical rabbit hole, as someone has called it to me. It has raised a considerable amount of professional anxiety, if you like. Some pharmacists are saying, you know, I'll never remember all of these things, and they imagine the other pharmacist have got all of these things off pat, and some pharmacists are just thinking, well, I'm not going to get there. But I'm going to suggest something different. Rashri, the next slide, please. My advice is to radically rethink your approach to getting service ready. So if you've still got work to do on pharmacy first, or if you're looking at the contraception service, my suggestion here is to flip things from the traditional 1, 2, 3 and stand it right on its head. I'm suggesting that pharmacists, the first thing you do is to look at the service delivery forms, electronic forms in this situation. Look at the actual boxes that have to be ticked. Consider the issues, the clinical issues that will definitely arise in the service at the point of care. And see the extent of clinical support in the delivery forms, in those electronic farm outcomes pages, the screenshots, you'll see them. And when you start there, this is before you've done any CPPE material, if you look at the screenshots, you'll enjoy some sort of a sense of decompression. You'll realize that you don't have to remember all of those exclusions, for example, because they're listed on the screen in front of you. So when you're studying, if you're conversant with everything, then you will be, well, it's all you need, because the prompts are going to be there. And it's a new approach, and I would really strongly recommend that to you. And if you still have to engage with the contraception service, the same concepts apply. The farm outcome screenshots are on the LPC website. So go onto the website, hover on national services, you'll see the contraception service and pharmacy first service coming up there. Click on the contraception service and you'll see there's hints and tips, but there's also this farm outcomes screenshots for the provision of the contraception service. Look at those before you get stuck into the study, and life will be a little bit easier. So here is a quick snip of the LPC website, our community pharmacy at Leicestershire and Rutland. There's a page of pharmacy support resources there. In the middle there, it mentions a video. We'll have a look at the thumbnail of that so that you recognize it in a moment. And there are all of the information that you need, the user's guide, the FAQs that Rashri mentioned, they're there at your fingertips on the LPC website. Just next one there, please, Rashri. So this video, we're not going to play it. If you still do engage, or if you're trying to encourage your locums to engage, get them to watch this video first. It covers some of the things I've already mentioned, all those screenshots. And when you look at this, you'll realize that it's not quite as formidable as you might previously think the whole service is. We'll crack on again. Here's some illustrations. There's PDFs on the website as well. You can see that the gateway criteria are on there, so you don't even need to have your Pharmacy First file on your lap when you're providing services. It's all there. Next slide, Rashri, and there is, for a particular service, all of the exclusions. So you'll be running your eye down through those. Again, you don't have to be turning pages in your training file. It's all there, and you won't forget everything because it's going to be right there under your nose. Next slide. So flipping it is what I'm calling it. I would suggest it's a bit like previewing a practical exam question before you do your revision. Because it identifies the clinical issues that's arising in service delivery. Then, in turn, it allows you to focus on what matters when you're doing your study. You'll be able to turn over a few pages quite quickly where you realize it's not central to service delivery. And it helps with your discernment when faced with dozens, so it seems, of suggested URL links that keeps popping up when you're doing your study. And it will allow you to be a lot more confident then before you actually start providing services. Next slide, Rashri, please. So moving on to the next bit of learning. The previous was obviously getting the study boxes ticked. Now looking at the operational time pressures. And the issue that I'm discovering is pharmacists still are not using their staff effectively. For example, let's just talk through a few things. I'm describing them as operational things that pharmacists could reasonably delegate to competent colleagues in the dispensary. At the very simple level, delegate checking for new referrals on pharma outcomes or in your email inbox, and perhaps set computer reminders. Get something, whether it's your phone or whatever it might be. I've got one pharmacy with an Alexa in the corner, and it chirps every little while a reminder to look at the to look in the inbox to see if there's any more referrals coming through. So delegate that to a member of staff. Next one, Rashri, please. And if a referral comes into Pharma Outcomes, for example, my suggestion is your colleague, when they see it, they simply print off the referral cover sheet and simply pop it under your nose, and you just glance at it and say, look, that looks okay, happy to see that patient, tell them to come in at 4 o'clock, 4 o'clock to 5, avoid lunchtime because staff are on holiday or staff are at lunch, whatever. You've really moved things on. All it needed was you to blink at that to give you some confidence and understanding of what's coming down the pipe, and your member of staff can contact the patient to arrange that appointment. We'll just crack on. So here's your colleague phoning up. They phone the patient and says, look, we've received a referral from the surgery. Can you pop in and see the pharmacist between 3 and 4 p.m.? And the colleague will say, I'm not a pharmacist if the patient starts talking symptoms. So again, you haven't actually had to divert yourself, and there's nothing there that's not operational that your pharmacy team cannot get stuck into. That's all they have to do. And they just need to say, I'm not the pharmacist. You can speak to them between 3 and 4. Your colleague would note it in the diary, for example, if they were coming in the morning, and perhaps set another reminder. And your colleague could also go on to Pharma Outcomes and do the patient registration if necessary. So all is ready on Pharma Outcomes. When that patient comes in, you sit down and you do a 10-minute appointment instead of it being 15 or 20 minutes. Rashri, next slide, please. The next bit of learning was around surgery referrals and the problems arising there. And we identified a number of referral problems. But what I would first share with you is that, and I'm not batting for the practices by any means, but I'm trying to explain why there are so many issues. Pharmacists would be surprised to know that practices received rather negligible guidance on Pharmacy First from central NHS when everything was launched at the end of January. Practices were anticipating a toolkit, but the promised Pharmacy First toolkit for practices and PCNs did not happen. They did get a quick and dirty referral guide. We'll look at that in a moment, but the inclusions and exclusions were inadequate, and practices were confused and sometimes led by media coverage. So what were we seeing? We were seeing practices referring patients who were out of the PGD age range. We were seeing practices referring patients with blindingly obvious red flag symptoms. And we were seeing patients sending patients to the pharmacy without an electronic referral. Just pop across to the pharmacy, they'll sort you out. Not sure if any of the colleagues on the call can resonate with that, but that's the feedback that I've been picking up, and we've been thinking through, and I'll share with you some thoughts on how to overcome some of those problems. The next slide, please, Rashri. This is the quick and dirty guide that practices received from NHS England to begin with. The inclusions, if you look closely, were inadequate, and the lack of excluded symptoms has led to numerous patients being inappropriately referred. Thankfully, LPC, we spotted the inadequacies of this within a few days or a week, and we rewrote it. If you look closely on the left-hand side, just look at the urinary tract one. There's no proper symptoms there for a surgery receptionist to consider, and there's no exclusions. You know, if someone had back pain or flank pain or whatever, there's nothing. And that's why so many practices were referring patients using this sort of material, which was inadequate, and pharmacies were receiving inappropriate referrals. If we crack on to the next one, the next slide, Rashri. So this is what we've produced at the LPC. And if you just look again on the left-hand side, the UTI, you know, the simple symptom terminology for receptionists to use for referrals obviously are in the green boxes, and the red box terms now include the exclusions. And, you know, patients with any of those red box symptoms should not be referred into Pharmacy First. But if you look closely, you can see how much more helpful the bullet points are, and for both inclusions and exclusions. And in my visits around some pharmacies, but also popping into surgeries, the previous inadequate referral guide is still pinned up on the walls in surgeries and under the noses of GP reception teams. So if you're getting inappropriate referrals, I would suggest you inquire, perhaps take this new version with you and say to your reception manager and your reception team, here's an updated one. It's much more helpful. If you've got the other one, chuck it away and use this one instead. We're advising receptionists, if they use this, to try and avoid mentioning the actual diagnostic terms in the white boxes at the top. Don't mention those terms to patients because it increases their expectations for antibiotics. And it really resonates with reception teams when we say how unhelpful it is when patients arrive demanding a prescription for antibiotics regardless of what the clinician says. You know, so receptionists are faced with that, and they will realize they would be causing the same situation for you when you explain it like that. Next slide, Rashri. Next one, there we go. So another issue that I'm discovering is, unfortunately, it seems like the rather high profile promotion of Pharmacy First and the focus that's been on the 7 conditions has given some surgeries the impression that Pharmacy First has replaced CPCS. So be alert to this and be sure to equally promote Pharmacy First minor ailments in conversations with surgery teams. Reception teams will already be familiar with this referral guide, originally for CPCS, and it lists around 72 green symptoms, all of which are treatable with over-the-counter medicines. And with Pharmacy First, pharmacists can now go a stage further with some of these, as highlighted in red, and offer prescription medicine treatments if any of the 7 conditions are recognised. So what this is essentially saying to receptionists is, guess what? You have been referring the 7 clinical conditions all along. What's actually changed is that pharmacists can now reach for prescription-only medicines. So if you look closely on there, the skin rashes is on there, sore throat is on there, bites and stings is on there, blisters, it's all on there. Receptionists have already been referring, and you could suggest that if they want to carry on using this, the pharmacist can decide, for example, if a bite or sting is infected or not, so that the receptionist doesn't even have to go there. They simply refer the issue as a minor ailment, and the pharmacist can escalate it into pharmacy first, one of the 7 conditions, if the pharmacist determines that a prescription medicine is required. Next slide, Rashri, please. So mentioned those resources. We've also put a page on the LPC website. Sorry, I must call it CP LLR, Community Pharmacy Leicestershire and Rutland, LPC and Old Money. So there is this surgery support resources page on the LPC website. So if you do speak to reception managers or practice managers, I would suggest you follow up that meeting with an email and give them a URL link to the surgery support resources. So your practice manager can share this URL, these resources, the introduction video and those referral guides to anyone else in the practice. A good tip to make sure that the news gets spread. Red flags, yes, let's just reflect on this one. So moving on, it's good to reassure reception teams that the consultation protocols pharmacists follow are designed to identify red flags, because we know that patients don't always mention everything they should to receptionists who are trying their best to assist. So surgery teams should be reassured that referrals back are a good sign of the protocols working, and definitely not an indicator of a poor service or of a service that's not working, because that's what some people are saying. We've referred the patient, they've been referred back. What a waste of time that was. That's because they're misunderstanding. And that's the point that I'm making here. When you're speaking to practices, say the pharmacist protocol is intended to identify those red flags. You can resonate a little bit with the practice team by saying, we know that patients don't always tell the truth and whole truth and nothing but the truth. So the pharmacist might spot a red flag that was not declared to the receptionist. And if that happens, they will indeed be referred back. That is good clinical vigilance. And the receptionist might say, well, look, I'm glad the pharmacist spotted that. I'll try and get you squeezed in with an appointment a little bit sooner. So turn that into a positive, really important point. And again, sticking with the referrals back and practices unhappy with that, put it into perspective. Here's a data set of referral outcomes. So you can see here, and you can share this slide with receptionists and practice managers, 80% of referrals for cough, colds and sore throats are being resolved by the pharmacist. 75% of skin rashes, as you can see, 80% of constipation and diarrhea problems, 80% of minor eye problems. You get the picture. So yes, there's going to be the odd referral back. It's important, though, to put that into perspective, and don't let practice teams develop a negative feeling because of 1 or 2 referral backs that's coming back to them. Next slide, please. I'm sure some pharmacists on the call are a little bit annoyed when patients just waltz into the pharmacy. I've been sent across from the surgery. Receptionists are saying to us, can't I just send the patients over to the pharmacy? Well, we know, and they have heard in the media, that pharmacists can self-refer, and they're thinking that, well, why can't I have a bit of this, save all the typing up, we'll just send the patients across the road. Verbal referrals are a common problem, and this slide, which you can use, it's in the introductory video that I mentioned in the resources to pharmacies. This is a little selection of very good reasons why receptionists should send electronic referrals. So study this and be prepared to make the case. A key reason is for making electronic referrals is that an electronic referral confirms the transfer of care from the surgery to the pharmacy. This is important because the patient came into the surgery expecting to see an NHS doctor in the first instance, and that creates a duty of care for the surgery. An electronic referral will therefore record that the care has been transferred over to the pharmacy. If you just send the patient across the road, where's the demonstration that the duty of care has been attended to? Another important reason is referred patients will be seen by a pharmacist in their private consultation room. Whereas you could infer that walk-in patients are likely to be seen by a chemist counter assistant at the chemist counter. Don't add in that you will intervene if that happens. Just leave that point hanging. An electronic referral, however, will guarantee an NHS pharmacy first service, but a pop over and see the pharmacy will not guarantee an NHS pharmacy first service. Moving on, consider also DNS or did not attends, which can be problematic if the patient says yes to verbal advice to go to the pharmacy and then they decide not to. What if the patient ignores the advice and went home and sepsis set in? What if they end up in hospital having spoken to the receptionist earlier in the day? Whereas if they'd done a proper pharmacy first referral, someone in the pharmacy team would contact that patient if they didn't come into the pharmacy, if they did not attend. The pharmacist would be effectively chasing them up, and that would reduce the risk of something untoward happening. And the electronic record would be proof that the receptionist had done their job properly, which is a point that receptionists will take on board. You know, in the public sector, unfortunately, there's a bit of a blame culture here and there, and you don't want receptionists to be dropped in it, but they can ensure that they're not, simply by doing their job properly, by sending that electronic referral, and they can then point to that electronic referral as evidence that they've done their job properly. Electronic referrals help collect audit data and evidence to report on compliance, especially to show that patients are accessing care within the recovery plan's target of 24 or 48 hours to be seen by a doctor. Practices are trying to demonstrate this, but that data is not being captured. They cannot account for patients being seen within 24 hours if they've just told the patient to go across to the pharmacy. Again, all good points to encourage practices to send electronic referrals. The final point on this is that pharmacists like the professional courtesy of receiving a referral, because they will be anticipating the patient then, or will phone the patient rather than the patient just turning up. Because otherwise, Sod's law dictates that the patient will stroll in during a frantically busy time or when staff are at lunch, and so the patient may have to wait longer than they might expect to. So the consultation gets off to an unsatisfactory start for all involved. So there's some reasons when you're speaking to receptionists. Moving on. Unfortunately, we've learned that some patients have reported feeling fobbed off to the pharmacy by some receptionists. These pharmacy team working posters, we produce them for CPCS, are still available to encourage patient acceptance of pharmacy referrals from surgeries. That said, the terminology pharmacy first is actually unhelpful in surgeries in that environment, because we want receptionists to refer suitable patients who are in the waiting room. We don't want patients sitting there waiting to look at a pharmacy first poster and decide, right, I've waited long enough, and just get up and go and walk across to the pharmacy first without a referral. So these posters have been designed to inform patients that NHS Pharmacy First is a high quality, planned and considered NHS treatment pathway. And these resources will counterbalance some of those negative feelings about pharmacies, about patients being fobbed off to the pharmacy. Cracking on, I hope I'm not going too fast here.
No, Gareth, we're probably short of time, so we're going to.
Okay, I'll wrap it up in 1 minute. So commercial reports, service volumes, claims and thresholds. I'm suggesting here this is probably an open house meeting on its own. Contractors need to monitor what they're being paid or what they're not being paid. And there's lots of misunderstandings going on about what's being claimed and what's being paid for. There's MYS service reports that I'm going to just tell you about, and then farm outcome service reports. Let's just crack on. So this is a screenshot of a MYS, Pharmacy First service report, January, February, March, you can see. And down towards the bottom, you can see how many clinical pathway consultations there were none in January there, 15 in February, just below that 13. You can see there was 15 clinical consultations and 13 prescription products supplied, and the summaries there. If you haven't looked at that, it's you've been on farm MYS and using it, but have you looked at the reports? That's there to help and support. Next slide, Rashri, is the one that come out just in the last few days from Farm Outcomes, Understanding Your Service Reports. I'll put a link to this. There's about 5 pages of this. This PDF. I'll put that onto the website in the next day or two. Next slide. This was a Pinnacle message. It flagged that services can be claimed up to 3 months after the date of the consultation. Hopefully you'll have seen that, but you'll be able to pick this up later. And then the last slide, is it the last slide? We talked about multi-factor authentication in pharmacies and also in surgery. So surgeries need multi-factor authentication as well, and some practices don't permit staff to use their mobile phones at work. So that's the nub of the problem in some of the cases. So Farm Refer is inoperable without multifactorial authentication, and NHS in Leicestershire is advising or recommending a desktop authenticator. It's called 2Fast. So if your local surgery is struggling with multi-factor authentication, tell them that you're aware that there is a solution and they should contact Melanie Burdett. Her contact detail is at the bottom of the slide. If you're aware that practice are struggling with this, all queries over to Melanie, and you can be confident that in the background there is a multifactorial authentication solution that she can help them with. I think I'm done. Is there another slide? Yeah, there is another one. Locums who work in the pharmacy, I don't think, if they're working in one pharmacy, then I don't believe there's any problems, but I would be interested. I need a recommended solution for locums who are working in different pharmacies for their multifactorial authentication purposes. And that is the last slide, isn't it, Rashri? Is there another one? I don't think so. Okay.
No, that's the last slide.
That's the last slide. Thank you ever so much. Any questions, Rashri?
Thank you, Gareth. So if you do have any questions, I know we've lost a lot of our contractors simply because we've gone over 9 o'clock, Gareth. So if you do have any questions, feel free to ask them now. Conscious that it is past 9 o'clock.
Yeah, sorry about that.
We need to call to pass. So if you have any questions, feel free to quickly raise your hand or pop it in the chat. Questions, Gareth, following on from his presentation?
Thank you.
No, okay, well, thank you. I just want to say thank you ever so much for joining. I apologise that it's gone over 9 o'clock tonight, but there were some important messages that we wanted to cascade over to you, and I didn't feel it was right just to shorten them in the amount of time that we have tonight. So thank you ever so much for joining. Feel free to ask us in the future if you have anything specific that you want to add in as an agenda item to the open house surgery. Just to reiterate, it happens on the third Wednesday of every single month at 8 p.m. So it's the same time slot each and every month. And if you do need any support on any of the issues or any of the themes that we've discussed tonight, please do get in touch with myself and the team, and you've got our contact details, and do visit our website, which is a resource and a plethora of information. Thank you so much, and have a lovely evening. Thanks. So I don't know if the admin team want to stay on. Anybody from the committee?
Well done, guys.
Thank God we've still got a couple of people still.
Yeah, I think the reporting, it's a whole session in itself.
Yeah, sorry guys, I just wanted to remove some people who weren't, just in case we go off, which we normally do in our discussion. So I've just taken them out the meeting now. Yeah, I thought it was a good, I felt like it was a good meeting. I think Gareth, I know you went over, but you did have you went over by about 31 minutes, just to feed that back to you.
Oh my goodness, sorry about that.
Yeah, so just be conscious of time as well.
Actually, you're still recording. If you want to stop recording, so when.
Well, Kate will edit it anyway, won't you, Kate?
Oh, okay.
Yeah, sorry.
But yeah, you can stop recording.